In the news today, there are several different topics up for debate. One of them is the United States healthcare system. This is at the federal level, and President Barack Obama sees that there are problems in our healthcare, and he wants to change this. I'll start off with a quote from Ed Gerdes. Nearly 11 million Americans who are already insured spent more than a quarter of their salary in healthcare last year, and over half of all family bankruptcies today are caused by these medical bills. So obviously the rates for medical care is too high for the average person to be paying. Also, for the past decade, many presidential candidates that ran for office, in their campaigns they said that they would reform healthcare. And after a while in their presidency, they'll slowly pass up the healthcare reform and never worry about it. Well, President Barack Obama really wants to change this now. What I want to talk to you about today is why we need healthcare, like why is our system failing, President Barack Obama's beliefs and viewpoints for his reform of healthcare, the opposing viewpoints onto Barack Obama's healthcare views, and the impact it would have on our society today. Well, why do we need this healthcare? Well, first, another quote from Jerry Geisel says, 1 out of 6 people in the population of Americans today are without healthcare. And also, I said earlier that families spend a majority of their money on health benefits or health care, and they slowly go into bankruptcy. Also, small businesses today can't afford health care because of the rates, because they're so high, and they've been laying off workers or just even going bankrupt because they can't afford the rising costs. Also, other nations around the world, say like Japan, have way better healthcare rates than the United States, and that is a problem because we are a powerful country. President Barack Obama's beliefs for healthcare, he wants to lower rates for low-income people and subsidize their taxes so they would have low rates for healthcare, and an opposite, he wants to tax surge on high-income people, so make high taxes for the high-income people so that it'll give the low-income people better healthcare reform. Also, employers must require benefits to their workers, and if the employers don't want to give the workers benefits, they'll have to pay the government so that the government can give the workers the healthcare benefits. In opposition of President Barack Obama's healthcare is it is highly expensive, and we've already passed a stimulus package, and a quote from Patrick Yost says, if we were to do that, far from saving money, the proposed reforms would add $239 billion to the national debt over 10 years. Also, another quote says by him, if we were also to do that, some 20 million Americans would lose employment-based healthcare insurance, according to some estimates. And workers that work for companies have given up wage increases just to keep their healthcare benefits, because that is a major and a must for workers to have healthcare. And if the employers will give that to the workers, why should they worry about getting healthcare, or why should they worry about getting taxed for healthcare? So it's not fair for the middle class people. The impact that the United States healthcare system reform would have on our society would, two quotes by Roger Hickey state, by 2015, 97% of all residents would have health insurance. So basically, all the people in the United States would pretty much have health care, besides immigrants and people that are not part of the country. Also, it would cost the United States $1 trillion over the next 10 years. So, for the impact on the United States economy is that it would be very, very expensive, and for the high-income people, it would cost them a lot more money with the taxes, even if they already have, right now, healthcare benefits through their employers. Well, in conclusion, what the main purpose of the United States healthcare is to determine the best and the safest, most efficient way of giving health care to every single person in the United States, and what is the most cost-effective manner by making it fair for everyone, and in turn giving the best health care for all the people. Well, President Barack Obama's health care reforms, he has many ideas, but these ideas are really not detailed at this time, so it's been giving people kind of false hopes for the healthcare reform. And because of this, a quote from Chris McGreal says, "That has proved to be particularly sensitive in the present economic climate, with the opinion polls showing that public support for Obama on healthcare reform has slumped to less than 50%, in part over concerns at the cost." So because of the cost, and because there are really no details for this, President Obama's support has slumped less than 50%. Well, hopefully there will be a healthcare reform soon in the upcoming future. Thank you.